Good morning or good afternoon if you're joining us from the East Coast, and welcome to another Formfast educational webinar. I'm Aaron Vaught, and I'll be your host today. Today we're covering a really important topic, namely automating consents. We know a lot of hospitals are actively looking to optimize their EHR, to eliminate paper processes. We understand that consents are still often paper-based at the bedside. So today we're going to be exploring the importance of automating consents, some of the risks of a paper-based process, and the benefits of automation, especially when it comes to the consent process. Before we get started, we'll go through some of the housekeeping items. First, note that the audio will be broadcast through your computer speakers for this event. We ask that you, if you're using the conference line, to mute your computer speakers, otherwise you might experience an echo. And if you're having problems with the audio, contact the staff via the chat or the question sections of the GoToWebinar interface. Note that you can submit questions at any time during today's presentation in the chat or in the Q&A portion of the interface. We'll save those until the end of the session and present those to our presenters. Today's presenters are both from Formfast. We're joined by Yancey Stout, our product manager, and Yancey has been instrumental in identifying the need and the requirements for our mobile bedside consent solution. So she'll be talking about what she's learned from working with hospitals and especially around the need for that solution. We'll also be joined by Ryan Brown from our solution architecture team, who'll be sharing a little bit about our technology and how we're addressing that problem. So without further ado, I will turn it over to Yancey to tell us a little bit more about the problem around consents.
Okay. Hello to everyone. Let me get settled here. Okay. So as Aaron mentioned, we're really looking to explore the risks of the consent process of yesterday, using paper, using pre-printed forms. How could we do that better? But first, really examining why. Why would we want to do that better? So I think a great place to start is reflecting on your own informed consent process. Shown here are some questions that may guide your reflection, your thoughts, and some additional ones that may clarify a little bit. Are your bedside consents paper? Do you print or grab pre-printed forms every time a patient is going to have a procedure or needs to consent to something, and those signatures are obtained on paper and then have to be scanned into the EHR? How often do forms get misplaced, or perhaps don't have all the fields filled out, or even signatures left off? Are the forms that you're using legible for the entire patient population? There is a growing elderly patient population, and we really need to focus on how their experience is with different aspects of their care, and that this is particularly one. The informed consent process is really important to establish that education and make sure that they're informed on everything that's going to occur with the procedure, why they would agree to it, what are the risks, and so that trust is built and confidence is established with the physician and the organization. So being visual people that many of us are, being able to review and really read that form is crucial. And are your clinicians, your nurses and physicians, asking about changing the process? Are they complaining about delays in care? And we'll talk more about that in a minute. Are they expecting a little bit more sophistication in the technology and getting away from a paper process? So let's look a little bit more closely at the risks of a paper consent process. If we step through the typical consent workflow, we can examine where issues may arise and where there may be concern, starting at the form preparation. So it's very difficult to manage in a healthcare organization the life cycle of pre-printed forms. When forms are updated, all of the current ones out in the departments and units have to be removed. The new ones have to be effectively distributed. Pretty big challenge. And so as an organization, many risk managers and clinicians and supervisors and managers can't really be assured that the form their clinicians are using are the approved and up-to-date forms. That's not a very comfortable feeling. They really want the confidence that the clinicians are using the right forms, the organization is covered, the best content is on that form for the patient. There's a reason that organizations update forms and update the consent content, because it's protecting the patient. It's better explaining that procedure and how it affects their care. And so having the most up-to-date form is pretty important to the process. Also, once the form is obtained, then of course a label or sticker with identifying patient information has to be applied, so then the form is archived correctly with the patient record. This of course introduces a possibility for human error. Even with the best clinicians in the world, humans do make mistakes. And as much of that as we can eliminate, the better. So then if we move into potential delays in patient care, the availability of the completed form in the EHR is crucial for anything that happens after that. The OR may be waiting to see that that's there. They have to confirm that's there. Physicians have to see that's there. They're waiting to continue with the patient care. And if the form was incomplete, archived incomplete, then we have to go and iterate the process again and make sure that the physician or whoever didn't fill out a field on there is tracked down and the form is properly filled out, and then perhaps there's another scanning process that has to occur. So that can introduce a lot of delays in patient care. Certainly, that's not good for the patient, very frustrating for your clinical staff, and incredibly hard on the flow of an operation of the hospital. We want to get patients in, we want to get them cared for, we want to get them back out in the community, and we want that process to be smooth. Organizations have all kinds of methods for scanning paper consent forms. One of the most interesting I've heard is where they had folders in all the patient rooms, and then completed forms were put in those folders, and staff would come by and pick up the forms out of those folders. Pretty good system, except there wasn't necessarily an established time interval between times when they would sweep through, and then once they were picked up, how long it took for them to be transported and then scanned in. no one knew exactly how long that would take. So again, we're waiting. And we can't really proceed unless that's there. Of course, that introduces another opportunity for forms to be misplaced, forms to be incorrectly scanned in as well. Or in the situation of an emergency surgery from the ER, where the consent form was obtained. However, because it's an emergency, the first priority is the patient, as it should be. And so the consent form is in the pocket of the clinician, trying to take care of the patient, which should be the top priority. However, that consent form may be really important later on and needs to be in the appropriate place, and it may very well get misplaced. So if that consent form had been electronic to begin with, nothing after that would have to happen, and there would be no concern any further. So really the idea is to cut out as much of the cumbersome parts of the process as possible. And what that allows the clinicians to do is focus on the patient and the most important part of that process, which is that conversation that needs to happen between the clinician and the patient to establish that trust, to establish the mutual understanding of the care. And this is what needs to happen versus another alternative. So what we're trying to do is streamline all the other parts of the process to make it easier on the clinician, more streamlined for the patient, and really allow for the focus to be on the care. So if we look at the cost of a paper consent process, there are, of course, financial costs to that we're going to look at in a minute, and those can be significant. However, first, I really wanted to focus on the clinician and the patient experience. The people of healthcare should be the focus. Clinicians are working extremely hard to provide excellent patient care, and the patient is why the healthcare organization is there to begin with. If your organization could reduce the bedside consent process by just a few minutes, how much would that be worth to your clinicians and patients over a month? How much time would they get back if they just gained a few minutes every time they process a consent? Over a year, how much would that be worth? So we look at the patient experience. The more delays that happen during a patient's experience, I mean, they're at a pretty difficult time having to, big decisions are made. They're concerned about their well-being or their families, and delays are only going to make that time harder. And again, the clinicians are building trust with that patient. And the more time that they're able to spend to actually focus on that, the better that's going to be. To make sure the patient understands everything that's going on, make sure the patient is clear about the care that they're receiving, and that they feel confident that's the right direction. As far as the clinician, I mean, they're fitting 18 hours worth of work into 12. So anything that can streamline administrative work is perfect. I mean, that's what we're aiming to do. And then the valuable time, they want time with the patient. And they don't want time with extra process, extra technology. We need to be very pinpoint focused technology that allows them to accomplish what they're trying to do and move them back to the patient. And that's really what we're trying to do. So given the significant EHR investment that all the healthcare organizations have made, that your organization has put the time and effort into the EHR, what message are you sending to your clinical staff and patients when you still have paper-driven processes that involve clinicians and patients? wouldn't you like to tell them something else and send a different message? So let's talk briefly about the costs of the paper consent process. They're more on the financial side. And so really this is intended to kind of walk you through a process of, what would that business case look like? What are the things that you might start to consider if you're looking at changing your process? Change is hard. So we're only going to make those big changes if it's really going to benefit the organization. If it's really going to benefit your clinicians, it's going to improve their job and their process. So, what are the things that you can look at? Many organizations that we've worked with have looked at cost per form to print, store, and effectively maintain pre-printed form inventory. Do you have an entirely separate storage unit just for pre-printed forms that is costing you rent per month? How much does it cost to print all those? How much are you throwing away with changes to those forms? And then, of course, you have the management of that whole process. So how much does that cost you per form? How much does it cost you in clinician and staff resource time for that form completion, obtaining the form, labeling the form, gathering all the signatures, making sure the paper form gets to the right place to be scanned, then the scanning process? How much does that cost in resource cost? Looking at the average cost of a delayed procedure, or cancellations. Are there situations where forms don't show up in the right place and that's actually causing cancellations? What does that cost? Some of that's kind of hard to put your finger on necessarily, but if you think about it, you may be able to figure out an average cost of that. How many of those do you have a month? And start to put a number on that. Number of consents, of course, would be part of the equation. How many are you doing? How many surgical consents? How many consents to transfer? Refusal of treatment. How many of those are you doing a month? And start to figure out how much that costs your organization. And what if you could improve that process? Of course, also hard to pinpoint necessarily, but something to consider, just like any risk that you're mitigating. Consider the potential cost of a lost or incomplete form when a legal issue arises. It only takes one to cause pretty significant issue to be missing. I talked recently to an organization, and they were missing one form, and they were looking everywhere for that one form. It was all about that one form. So all the thousands of consent forms that you and your organizations process through each month, it only takes one to cause some significant issues. So if you can be sure that all of those are going to the right place automatically without any human intervention, that may be a better place for your organization and save the heartaches later. So hopefully this kind of walked you through thinking about some of the risks. We really enjoy talking with organizations and learning what their process is. We really want to meet them where they are. How do we improve your process? Everybody's is different, and we like figuring out what the solution is for a particular organization and how much can we improve that. And it's a great discovery process to figure that out. Ryan is going to talk to you a little bit more about that and some of the capabilities of our solution and how we would go about exploring that with you. And, you know, extending this thought, and can we put some numbers, can we build the business case? You know, the important thing is that your organization sees that improvement. Your clinicians have a better process. Your patients have a better experience. And your organization sees the cost of healthcare perhaps decrease. All right, Ryan, you want to take it over from here?
Thanks, Yancy.
Let
me just bring up my iPad here. You guys will be able to see my screen here in a second. All right, good morning, everyone. As Yancy previously discussed about our mobile bedside consent solution, I just wanted to take a few minutes today and show a quick high-level demonstration of it and some of the features. Please keep in mind that for today's demonstration, it is high-level, so I'm not going to highlight all of our individual features. I just wanted to show you guys a quick glance at what it looks like. And then, you know, if you are interested, what we could do is schedule a follow-up one-on-one demonstration with your hospital to talk through all the individual, you know, areas of integration with Cerner, Epic, McKesson, Meditech, really any of the EMRs out there, and also how we can merge some of that EMR data onto our forms and send the data directly back into your electronic health record for the patient. So it's really nice. It's going to eliminate all the printing and scanning of documents. As Nancy previously mentioned, you know, one missing signature could really impact the hospital. And with our solution, as a hospital, you can pick and choose what field should be marked as optional and what field should be marked as required, just to ensure that you're capturing all that information that you need for a patient consent. So on your screen in front of you today is just an example consent form that I have loaded on my Apple iPad device. And you'll notice what's really nice at the very top of the screen, where we have the patient information for my patient name, date of birth, and medical record number. Any of that information that's stored in your EMR systems could be merged, you know, through an HL7 ADT message directly onto our forms to pre-populate the forms. So it eliminates the sticky labels that you would apply to paper documents. All the patient demographics are automatically merged onto the form surfaces. Down below, under my statement of consent, you'll see that I have a couple fields that are highlighted in green and blue. Again, we could take that information from your EMR, such as the physician name and the patient name, automatically populate those fields onto the form, but then in the event that maybe the information's wrong and you need to make a change, so maybe rather than having Dr. Bodos, I could, you know, backspace there and say, you know, Dr. Fine is performing the procedure. The fields will be highlighted in green to show that information has been captured. And then the blue fields would indicate that that particular field has been marked as optional by your organization. So again, you could pick and choose what field should be optional and what field should be marked as required. Our solution does support using checkboxes as well as fillable text boxes. So I could very easily click on, you know, maybe it's, you know, right or left. And then if I scroll down again, I'll be able to see the areas that I need to gather my electronic signature. So in this particular example document today, I have my signature of patient and also my physician's signature marked as required, which is why they're highlighted in red. So any field that your organization marks as required must be filled out, and that could be a signature, a checkbox, or a fillable text field, but it must be filled out before you archive the document electronically back into the electronic health record. You'll also notice if I scroll down to the second page here, I can just scroll through the document. I have a bunch of different paragraphs with check boxes. So as part of, you know, a more in-depth discovery session with your hospital, we could talk about your forms and how we could load them directly into our system for a demonstration and show you some types of, you know, a few different examples on, you know, filling out those forms electronically, adding check boxes for different categories, etc. Now, the last thing I wanted to show you here, just real quick, to capture that electronic signature, it's very easy. You can hand the device over to the patient, and all they would have to do is click on the field. So I could click on signature of patient, and that will pop up my signature box and note that it says required patient signature. And then either using my finger or a stylus, I could write directly on the screen, click on accept, and that will apply my signature to the form. So you'll notice here that my signature is now on the document. We're automatically inserting the date and timestamp. And if I scroll up, any of those fields that I previously filled out are now flattened and locked down to prevent any changes from being made. So that's really another nice feature about performing your consents electronically. On paper today, a patient can sign the document, but someone else could always check another box or scribble additional information onto the form, and you're really not sure what came first. But with our electronic signature solution, once we capture that first signature, we lock down the form to prevent any changes from being made. So that's really just a very high-level demonstration of the product today. You know, after the staff members fully completed the form, they do have the option to print the document at the top if the patient asks for a copy, but if not, they can just very simply click on Done, and this will send the form directly over to the patient's health record, and it would be available immediately, you know, anywhere in the organization. So there's no waits, no delays for, you know, taking a paper copy down to HIM, having them scan the document back in. Everything's now electronic to eliminate the paper in your organization. So what I'm going to do now is turn this over to Aaron, and we have a few minutes for any types of questions and follow-up.
Great, thanks Ryan. Like Ryan said, it's time for the Q&A portion of the event. We have one question that's already come in. Can you customize our forms? And I'll direct that to either Ryan or Yancey.
Sure. Yeah, that's a great question. So, you know, as part of this webinar today, we do, you know, address the solution, show you some of the high-level capabilities. But what we could do in a more in-depth demonstration is we could definitely take any of your forms and load them directly into our system and show you a demonstration of filling out your own forms with our mobile site consent solution. As part of the Formfast solution product suite, there is a form design application that makes it very easy to take any of your forms today, whether or not they're on paper, PDF files, Word documents, images, and convert them automatically into our system so that they're identical and the look and feels the, you know, what your staff members are used to already.
Great. During the session, we had a quick poll to see what mix of attendees have a paper-based process versus a somewhat electronic process with a signature pad. 91% of the attendees were on paper, 9% with signature pad, and 0 with a mobile device. So definitely validation that there's a lot of paper out there, a lot of challenges around the paper process like Yancey talked about. But for those that are using a signature pad to capture signatures at the bedside, what words of advice would you have about exploring a mobile solution and why that might be a better offering? And once again, I'll direct that to Ryan or to Yancey.
Sure. So part of it is focusing on the patient experience. A lot of times in that scenario where they're using a tethered device, signature tablet, then they're not actually, they can't easily view the entire document. And going back to what I said about often people are visual, and it helps them to actually be able to review the document and review the form, that content that's so very important, and that your organization really worked hard at maintaining and updating appropriately. So with our solution, with a tablet, a truly mobile device, they can view the entire, they can make it bigger, which again goes towards the legibility of the form and making sure that the entire population can clearly read it without difficulty and adjust it. They can really make sure that they understand the document. As well as often the patient, if they're in a prone position, in any sort of type of pain or just the inability to really move that much, then trying to lean over to sign a tethered device or trying to get that device to them is very difficult. Whereas a mobile tablet device, such as an iPad, very easily positions in multiple ways makes the patient's experience much better in that way. So that's really just some of the benefits of the mobile device. Certainly it makes it easier. Clinicians can move around much faster, going room to room and addressing those tasks that they have. So it really impacts both the clinicians and the patient.
Great. Got a couple other questions that just came in. One is regarding Epic. This attendee is using Epic as well as Perceptive Image Now as their document management system. Wants more information about how those electronic forms get into their document management system.
Sure.
I'll direct that one to Ryan.
Okay, yeah, so we do work with Epic and Perceptive and Highland, really any of the EMR systems out there, and the scanning and archival content management systems as well for your hospitals. That's something that we'd have to discuss in more detail on a one-on-one basis, just to find out the specifics on how we would handle that integration at your organization. But very high level, basically the EMR would send us an HL7 ABT message with the patient demographic information. And in the process of getting the forms, those signed documents back into your system, we would use a cold feed interface to feed the signed documents with a metadata file that just identifies the form. So that would have, for example, your patient information, the medical record number, account number, etc. And the Perceptive systems, Epic, etc., can read that information in and import the file automatically into the health record. But that's something that we definitely want to discuss with you on a more one-on-one basis, just to get the specifics and work with your IT organization with how your system is set up, just to make sure that we have the data flowing back and forth correctly.
Okay, a couple other questions that we'll lump into one. One, what mobile devices do you support? And another to do with infection control, are the devices easy to clean?
Yeah, this is Ryan again. So primarily what we've seen at other hospitals are Apple iPads and Microsoft Surface Pros tend to be the most popular tablet devices. Our application is HTML5 based, which just really means that any type of newer tablet out there today should be able to run the application to allow your patients to sign the documents electronically. In regards to infection control, it really comes down to the device that's being used. There are hardware manufacturers out there that make protective hospital-grade sleeves that wrap around devices. There also have been published government studies on, what's an approved cleaner using alcohol wipes, et cetera, to wipe down the device. So it really comes down to the devices that you pick and choose to use at your organization. At Formfast, we'll make some recommendations of best practices that other hospitals have been using with success, but the Apple iPads and the Surface Pros tend to be the most popular devices out there.
We've also heard from organizations that are using iPads quite a bit that they've put in some best practices of not actually handing the iPad to the patient, but turning it around. And they found a case that worked out very well for them to address the infection control. And so we can provide that information as well and get down to the specifics of which device do y'all want, and then what would be the best infection control process and best practices for your organization.
Excellent. A couple more questions we had come through about how to get more information and including pricing information. That's a good segue into my wrap-up. So I will thank Yancey Stout and Ryan Brown for their presentations today. And to find that information, we invite you to go to our website, click on the link from the homepage to learn more about mobile bedside consents, including some of the things that we're getting questions about in the chat. around specifics in terms of pricing information and to schedule a demonstration. We ask that you go to formfast.com/contact, and there's a form that you can fill out there. Just indicate in the description what sort of information you like and what you'd like to see in that demo. In addition to visiting that link now, we're also going to send out a thank you email in about an hour that will also have a link to take you to that form so that you can easily connect with our team and learn more about this solution. We want to thank you for your time and encourage you to look forward to other Formfast educational webinars in the coming months. Thanks again.